open up for, I have a couple questions for our panel, and invite those that are also tuning in online to submit questions as well. And then we will have someone with a mic throughout this room. And I wanted to start off with a question about maintaining prioritization. And, you know, over time, economies, governments, priorities continue to change and shift over many years. And I know, although at Milken, the network is new, but Milken is not, and you guys have experience over some decades, as well as with CIHR and in Australia. How do you ensure that your work is prioritized in remaining funded and has a sustainable funding stream as we see these shifts throughout time?
So, okay. Hello? Okay. Yeah, so this is from my perspective as the scientific director of a health research funder. This is sort of why we started with the policy of sex and gender integration across research, because it really brought in the entire health research community, right? So rather than saying that, depression is important for women's health and that's our priority, or, physical activity is important, or vaccine uptake is important. It was like, no matter what you're doing, it's important. And so that was sort of the beginning of our policy. More recently, as we've had to focus on women's health research, we haven't taken an approach of this is the disease, the health condition that is the priority, but rather these are the approaches that we need to make a difference. So if that's about implementation science or translational research or adopting AI methodologies, we've tried to use that because our research community is very diverse. And so we want to bring everybody in to the work.
And I would say for us at Milken, we aim to address key challenges and issues that are facing the ecosystem. And for us, that's a focus on health, but also those that sit at this intersection of health, finance, and philanthropy. And so women's health has been one of those areas that for years we have identified and put forth thought leadership to help to support and advance. Throughout our large convenings and events, we have focused on the challenges that affect women and women's health, and talk through some of the solutions. I think that where we are now is recognizing that there's an opportunity for us to really put a line in the sand to leverage our skill sets and expertise at this intersection, as I've mentioned, of health, finance, and philanthropy, but also our convening power and our ability to build alliances that are long-lasting and sustainable and that produce impact, and to put that towards women's health. And so we prioritize the issues that are facing the health of people, and women's health is one of those areas.
And then Deb?
Yeah, I think it's not always easy to maintain sustainable funding. And I think for us, it's been critically important to, and I mentioned just at the end, to have that bipartisan approach. We're not political and we don't make political statements. What we do is provide our research to whoever is there, but usually through the public service. So it's the department, not the politician, who receives the information. So for us, it's been important to form relationships with the public servant who is in the position of making change in women's health or setting priorities in women's health. Those positions, the people in those positions change quite frequently, but we do have a bit of a strategy of maintaining those connections with different members of government departments, and that has been very important for us.
Thank you. Do we have any questions in the audience? And we ask that questions be very brief. You can introduce yourself and limit it to less than 60 seconds, please.
Norton Interim, Clinical Director for Women's Health in an NHS unit in London. My question is really on the inclusion bit of your 5 actions. And clearly, you may be a woman, Black, living in a deprived community. There are multiple layers of inequalities. And I wonder whether you will touch on the funding specifically to that group as well in terms of research. Thank you.
I think that's a question for me. Yeah, thank you for that great question. I tried to emphasize how important it is to consider that our work has to be inclusive. It has to be really, really clear that there are inequities among women that sometimes are much greater than the inequities between men and women. And I think we haven't said enough about that here. The initiative that we have launched has named that very explicitly. So in the Canadian context, I can only speak to that, is that the key communities of women that are even more desperately underserved by our health research evidence base includes Indigenous women. It includes African, Caribbean, and Black women. It includes newcomers and refugees. It includes women living in rural settings and women who identify as Two-Spirit or LGBTQI+. And so we've been very clear in our funding opportunities that a middle-of-the-road approach to women's health is not going to get us to where we need to be.
We have another question.
Hello, everyone. I'm Eleanor Wadinobi. I'm the president of the Medical Women's International Association, an association of women doctors who are 105 years old. Regarding healthcare financing, and you spoke eloquently about the intersection with philanthropy, I am quite concerned about the exclusion, or if you want, inclusion, as the previous speaker spoke about, of rural indigent women, and how largely those of us in the research world have not adequately looked at compensation for these vulnerable groups who participate in research. A quick example, a woman in the village leaves her livelihood. She will travel several miles probably to get to the data collecting center. And we haven't thought enough about how, in leaving her livelihood for that day to participate in data collection, where she can probably get access to internet, that she is losing out somewhat. So how do we ensure that those who participate are adequately empowered? Thanks very much indeed.
Deb, I would shoot that over to you because of the study, and you can speak to some of the challenges and successes you've had there.
Yeah. So our surveys are available online, but also paper for 3 of the cohorts. So it is possible for those to be mailed out, filled in and mailed back. We also will do phone interviews if that's something that a participant wants, rather than filling in a survey. All of our participants are also offered compensation that varies depending on how long the survey is. And I will also mention a couple of other things in terms of equity. We oversampled in rural and remote locations to ensure that we had enough women to be able to make statistical comparisons. You'll remember on the map that I put up, we have this very sparse population across the middle of Australia, and we were keen to get as many rural and remote women as we could. So even if you have percentage representation, you might not have enough in terms of whole numbers. So we sampled at double the rate in rural and remote locations. We're also in the middle of doing what we've termed a cohort refresh to ensure that we have adequate representation of newcomers, so people who've newly migrated to the country, but also people who are likely to be underrepresented in research, so rural women, but also women from lower socioeconomic brackets.
Is there any additional? We have another question in the back.
Hello, good morning. My name is Chi Ling. I'm from Singapore, and I work mainly in the intersection of healthcare and technology. And for the past few years, I've been working with New Zealand health systems in addition to the Western Pacific region. And one observation as a social entrepreneur myself is that there's a lot of venture capital funding going into healthcare startups or healthcare companies, and the tendency is for investors to say, can you build products, but let's start with men, right? Instead of really focusing on women. There's disproportionate amount of VC money going into commercialization of research into products that people actually use. I'd be curious to hear your thoughts on how we could address that disparity on the industry side of things, and what role might philanthropy what role could philanthropy play in adjusting, that disparity?
Thank you for that question. I do joke about how I'm so glad that I have colleagues that focus on finance, because I am not an investor and I don't even play one on TV. But I think to your point, yes, VC dollars have been limited in terms of focusing on products and services that support women's health. I believe it's probably less than 2%. And so we recognize that is a challenge, and it leads to a huge unmet need for women. One of the things that we are hoping to do is to use the Women's Health Network as a space to help to address that. We want to make sure that VCs understand that funding products and services that support women is not a nice to have, that there's a business case for it. And so we are hoping to be able to ensure that, and to have a number of VCs who are a part of the network who can help to grow and ensure that message is communicated, and also working to build the funds that would help to support businesses and innovators who are at that stage.
If I could just add one very quick thing so that we can connect later, but there is a group in the Canadian context called Femtech, and their specific interest is right in where you're talking about. Is there's so much opportunity in digital transformation and all of these new AI tools, et cetera, for women's health that is not being realized yet. And so we've been collaborating with them to ensure that the data, the evidence base that is used to build these products is informed by women's experiences. So we're not just like replicating the same biases that I talked about earlier. But certainly that's a group that I could connect you with in the Canadian context.
I think we have time for one more question.
Hi, is this on? Okay. I'm Shirley Malcolm from the American Association for the Advancement of Science. I have been very impressed with what Canada has been doing in terms of trying to shift the processes, and so that you can have research really, which is really reflective of what you were talking about. I've worked for years with Kara Tannenbaum, and so this is, I know what you have gone through in order to get to this point. So the question is, if all of the kind of requirements of the agencies went away tomorrow, to what extent has there been, do you feel there has been a sufficient cultural shift among the researchers so that they would continue to do the work because they understand its relationship to doing quality science, and that's what excellence is about. Because your processes and things can go away overnight. And so to what extent would the community hold on to those values?
Yeah, thank you for that threat. Yeah, I mean, I think that's the kind of like an actual billion-dollar question for us. If I am optimistic, I do think that there has been a cultural shift in Canada. I'm coming into this role, honestly, after so much of the hard, groundwork has been done, right, to convince our community that this was not just another, administrative exercise that we were going to require everybody to do, that we had to shift our understanding that this is about the best science. And this is about being accountable for taxpayer dollars that are paid by all of us, and our health research ecosystem needs to reflect all of our needs. So has there been a sufficient cultural change that without our policy, it would continue? Some. There has been some. And some of our most effective spokespeople are actually the converts, the people that created a lot of problems for us in resisting this policy, who have then, they can tell these incredible scientific discovery stories about, I never used to enroll female mice, include female mice into my investigations. And as soon as I started to do that, I saw different biological paradigms fall apart, dogma that we used to believe in terms of, say, chronic pain or antibiotic response that fell apart because I did so. And those are the stories that I think we need to continue to advance, right? That it's about discovery, and that makes a difference when you're a scientist.
Thank you. Well, we have to close this session, so we can do during the open discussion portion. We'll come back to this question. Because as we close up, I want to ask final thoughts. We are about 2/3 of the timeline through working through the Sustainable Development Goals. And what would you recommend, very briefly, global leaders keep top of mind when it comes to prioritizing women's health? And your final thoughts. We'll do Ayodola, and then we'll go to Deb, and then we'll end with Angela.
Great question. I think that I would encourage us to really understand that there is a true opportunity here for us to be able to address the health of women, and by focusing on unmet needs and partnership, that we actually have a real opportunity here to make a difference. And that can have a huge impact on us economically. And focusing on women's health is not just a nice to have. It can really impact the way that women are able to live their lives, care for others, support the environment, and the economy broadly. But it's imperative for us to ensure that there is funding for research and development and innovation.
Deb?
I think it's really hard to add to that, Ayodola. That's an amazing answer. I guess the thing that I would add that has been critical for us is to always include the voices of women within our research. And so we'll always consult with women as we put surveys together, decide what needs to be asked, and so on. And I think we take that responsibility to heart. And it's something that we've been really pleased to see reflected in the National Women's Health Advisory Council as well, where they also go to the public and ask women, what are your most pressing needs? And I think that's something that we need to just keep front of mind all the time. Thank you.
I mean, I can't really do better than these two answers, and just really to double down on that, investing in women's health is a cost savings measure. Right? Investing in women's health and women's health research will save us lives, poor health, healthcare system costs, improve our societies, our communities, our next generation. And this is actually a huge economic opportunity. So if you are not compelled by the social and moral imperative to do this work, then be compelled by the economic opportunity that is right at our fingertips.
I love that. And just, summarizing, it's not just a humanitarian case, it's a business case as well. And so thank you so much to our panelists for sharing their models with us and for giving us their insights on how we can continue to prioritize women's health at a national level in our own context. Thank you very much. And at this time, we have a bit of a break, so we definitely encourage everybody to continue to network. We are here to connect and collaboration, to facilitate collaboration. And so we will resume at 10:50 on the dot in about 15 or so minutes to come back through.